And then there's the treatment gap, another eye-opening part of this epidemic. Despite how common anxiety disorders are, the majority of people suffering never receive help. 3 of 4 people with anxiety disorder will not get the treatment they need. So only about 1 in 4 actually receives any form of treatment for their anxiety. Imagine if only 25% of cancer patients got care. We'd consider it a global emergency. Yet, with mental health, this has been the norm. The reason vary. In some places there simply aren't enough psychologists or doctors. Many countries have just 1 psychiatrist per 200,000 people, or even fewer. Other barriers include cost, lack of insurance coverage, or lack of community support. And of course, stigma looms large. People fear being labeled weak or crazy, so they suffer in silence. In many cultures, talking about anxiety or depression is still taboo, something kept behind closed doors. The result of this treatment gap is a lot of needless suffering. Anxiety disorders are actually highly treatable with therapy and medication, or both, boasting success rates that would make many physical illness jealous. Yet, most go untreated, and untreated anxiety doesn't just remain static, it often worsens or lead to other problems. For example, without help, Jill's panic attacks could spiral into avoidance of all situations that might trigger a path that can lead to agoraphobia, fear of leaving safe spaces. In fact, untreated anxiety in youth is associated with higher risks later of depression, substance use, even suicide attempts. So the stakes are incredibly high, not just for individuals, but for societies.